My name is Dr. Sidney Rabinowitz. I'm a board-certified plastic and reconstructive surgeon, as well as board-certified hand and microsurgeon. Carpal tunnel syndrome is a very common nerve compression syndrome in America. It affects even up to 10% of diabetics and almost up to 10% of others, irregardless of what you do for work. The symptoms primarily are numbness and tingling involving your fingers, but usually it's your thumb, index, and long finger. In addition, you could have pain at night that wakes you up from sleep. Carpal tunnel syndrome is primarily a diagnosis that's made clinically. By history and physical examination, we look to see if there's any issues of long-term nerve compression on the hands, such as atrophy that we may see with the muscles. And diagnostically, we can get what's called an EMG or electromyographic test, and that looks at the actual velocity of the nerve and if the muscles are affected because of loss of nerve supply. For carpal tunnel syndrome, the treatment options are multiple. It's a hierarchy, so we usually start with non-invasive conservative measures such as splinting, non-steroidal anti-inflammatories such as Motrin or Relieve, and splinting at night, rest, perhaps some changes in our occupation and use of the hands. Thereafter, if that doesn't work, we can move to the next more aggressive treatment, which is usually a steroid injection. But quite frankly, depending upon how bad and how severe their symptoms are, some people we have to bypass those altogether because they're not a candidate for non-operative measures, and we have to move to surgery as the best option. The carpal tunnel surgery is right for the patients when their symptoms interfere with their ability to perform their activities of daily life, and when there's a concern that there'll be permanent nerve damage. The surgery itself is relatively simple. I do a very modified approach with a limited incision. I think this offers the best chance for recovery with the least amount of risk taken for the procedure. Typically, the surgery takes less than half an hour. They go home the same day, and they can go back to their work if it doesn't involve heavy lifting within 2 weeks. And people who are heavy laborers can usually go back between 6 and 7 weeks post-operatively. And the success rate is terrific. It's 90 to 95%. On surgery day, this is an outpatient procedure. The anesthesia is something that the patient will confer with the anesthesiologist about. We can do this either under straight local anesthesia, meaning they're awake, or with sometimes like a twilight sleep, where they're asleep but there is no tube inserted into them. And for patients who are very concerned, who are very nervous, which we see from time to time, they can undergo general anesthesia for this. But regardless, the procedure is an outpatient procedure, and they typically will go home an hour, hour and a half following the procedure, and there should be no issues with carrying on the rest of their day. Fortunately, carpal tunnel surgery is very successful. The only time we may not see the degree of success we prefer are patients who typically wait too long to have the surgery, but forgetting those, we can expect a 90 to 95% recovery in terms of return of sensation and feeling to the fingers, certainly full strength and range of motion of the fingers, and for people who work or have activities they like to do, such as hobbies, we expect them to return fully to that with full strength.